Battle-weary but match-fit, Victoria back in lockdown for 5 days.
I am confident that this short, sharp circuit breaker will be effective.
Back to 5K limits, back to masks outside the home, back to those familiar 4 reasons to leave the house.
Shopping for what you need when you need it. Caregiving and compassionate reasons. Essential work or permitted education where that cannot be done from home. Exercise for 2 hours per day.
Childcare remains open, but schools will shut. And while the Oz Open tournament will continue, crowds will be sent packing. The UK strain proving too quick for contact tracers to keep up with.
If you haven't got a lead-in period to wrap a public health response around people, then you have to go broader. And that's what these decisions today are all about.
Today, the Holiday Inn cluster grew to 13, with 2 new cases, one of which spent 8 hours at a busy airport cafe while infectious.
We've essentially had a super spreading event at the hotel.
But it's the cases we don't know about that are most worrying.
We must assume that there are further cases in the community than we have positive results for, and that it is moving at a velocity that has not been seen anywhere in our country.
The PM today threw his support behind the decision.
A proportionate response that enables those, the tracers and others, to be able to get on top of it, that can and will be achieved here.
Other states moving quickly to shut their borders. Everyone but New South Wales closed to Melbourne.
From 1 a.m. Saturday, we will close the Queensland border.
We extend our border restrictions.
There will now be a 72-hour hard border.
So as Victoria braces for its 3rd lockdown, will this circuit breaker be enough to prevent a 3rd wave?
We've all done too much, given too much. We've built such a precious thing, and now we have to follow the advice of the experts to safeguard it.
Well, Associate Professor Hassan Valley is an epidemiologist from La Trobe University. He joins us now. Professor, is this the right move?
Look, I think that's a really difficult question to answer, but what I can say is the rationale is very clear. The philosophy here is to pay a small price now to prevent having to pay a bigger price down the track. And with these short, sharp lockdowns, the goal is really just to buy time to allow the public health team to do its work and get ahead of transmission. So, all of us living in Melbourne are just hoping that we're able to achieve that.
So is it possible for contact tracers to keep up with this UK strain once it's out there? Because Dan Andrews seemed to be suggesting it isn't.
Yeah, look, it certainly is possible. And I think we just have to understand that whilst this is essentially the same virus, it's supercharged, if you like, it's fitter. And so we have to lift our game. And we've spent the last 12 months learning how to deal with the original wild type virus. And now we've just got to learn how to respond even better to deal with the new threat of these variants. So we've been learning all the time, and we've just got to continue to learn.
Do you think this means that any time there's a leak of this particular strain from hotel quarantine that we will need to lock down again?
No, I think that's a really important question. And, the definitive answer is no. I think we have to understand that there are probably a few unique things associated with this event, and we've got to be careful not to generalise. So I think we're more than capable of dealing with the odd escape from hotel quarantine, and so no one should think that this is the standard playbook, I guess, for when this sort of event occurs.
Professor Dan Andrews today said some cold, hard decisions need to be had on how many people come back to Australia, given the ferocity of these new strains. Is that something that we need to look at?
Look, I think it's reasonable to suggest that we look at that, but really this has been an ongoing conversation for the last 12 months as to how to bring people into the country. And, I think anytime you bring people into the country, as harsh as it sounds, you're potentially bringing the virus into the country. So, we've just got to keep working on doing this better, improving our processes, fixing any gaps that we have in our system, because it's a reality. It's the way the world is going to look like for the near future, and we can always improve what we do.
Prof, what about the idea of a federal takeover of quarantine? Queensland is once again pushing for that. Do you think it should be on the table? Yeah, look, I'm lucky as a public health person. I can say I don't really care how it's managed as long as it is managed and managed well. So, I think that's the key issue. It doesn't matter where these facilities are. It doesn't matter who's in charge. That's a decision for the politicians to make. From my perspective as a public health professional, I just want it to be run well, and I want, the virus not to escape, and I want us to not have these sorts of lockdowns. But I suppose you're the epidemiologist, you're the expert. Which do you think does that more effectively? Hotel quarantining as it is now, or this idea of remote centres, for example, that the federal government might run?
Yeah, look, I think there's a strong case for having these centres away from urban areas, but it's not so much about the location. It's about the facilities that you can sort of purpose build, in these remote areas. And so, then you're up against the practical issues of how quickly can we get that up and running. So, there's still challenges to overcome, but you can, no one would doubt that there's a lot of discussion going on behind the scenes to try and work this out.
Yeah, definitely no easy fix here, rather. Professor, thank you so much for speaking with us tonight.
Thanks for having me.
It really is interesting about the remote centres that could be built, and do we have the time and how much time do we need? It's just an ongoing thing. What do you think? Do you think this is something the federal government should be taking over?
I think it should, frankly. I think we're at the point now with all these mutant strains that are coming that are so much more highly infectious. But frankly, I've got to say this. We've been in this pandemic for 12 months. The whole point of having professionals in public policy decision-making is planning.
Yeah.
And why at some point between the start of this and now, have we not looked at this and moved towards it already? Because it's all about the planning. You heard the professor there talking about the need to have purpose-built centres. We don't currently have purpose-built centres. So if it's about getting the ventilation right, getting the air conditioning right, locating it somewhere remotely where you can have, for example, an airport there that can be internationally direct so that you don't have travel through different communities to get the people there that might have COVID. Why hasn't all of this been done before now? It really should have been as part of the overall strategy, whether it's about the vaccine, about managing cases when they happen. This should have been done. Governments can walk and chew gum at the same time. And whether it's the state or federal governments, they have dropped the ball badly on this issue.
I feel like hindsight is such a gift, though, and it's really tricky. The UK strain is another situation that we didn't anticipate at the beginning of all this. I just think it's a really difficult call.
I would just hate for Australians overseas who have been waiting to come to Australia for so many months to bear the brunt of this. I really hope that we can. I really do hope that we can sort it out here without having to limit numbers of people coming.
I agree with that, but that is all about forward planning, and governments, it's complex governing, and you've got a lot of public servants, a lot of people looking at it. They should have been looking at this on the way through.
All right, you're running hotel quarantine from now on.
Yep, PBO for
really
PM. And as someone with a dear friend in hotel quarantine in Australia at the moment, who is waiting for her husband and son to join them, let's just keep the flow of people coming in, please, and then just stop the virus getting out.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.